grind this cartilage away, and that leads to joint cartilage damage. And in the long run, joint cartilage damage is actually arthritis, which is a permanent skeletal or bone joint condition. When all the cartilage or the ends of the bones that are rubbery, if you eat a piece of chicken, a drumstick of a chicken, the ends of the chicken, the rubbery part, that's cartilage, and that gets ground away, and then you have arthritis. Here is a picture of scarring or fibrosis inside your body, and what the scarring is actually like tough gristle in a piece of steak. In this picture, you can see there's blood vessels on the left upper portion of the picture. The red kind of the lines. These are blood vessels over here, and this is other tissue. And the two different tissues are being bound together by this white kind of. It looks like almost spider webs or cobwebs, and that's the result of injury. That the cells are trying to regenerate, but instead of regenerating more muscle tissue, it generates this scarring tissue that interferes and causes the stiffness and the ongoing problems. So the key thing about treatment is to prevent this scarring from happening, this cobwebs from forming inside the tissues and inside the joints and inside the muscles, because that will just lead to the pain that goes on and on for months and sometimes years, or sometimes it goes on for the rest of the patient's life. Here's some MRI scans. Here we have the vertebral. I'll just follow the arrow here. This is the vertebra, the top of the vertebra. This is a slice of the human body. So we're looking on top of the vertebra. So this is the vertebra here. The circles beside the vertebral body here. These are muscles. The psoas muscle they call it. So this is a muscle, and this is a muscle, and this is the vertebra here. The white portion here, that's the spinal cord in the spinal canal. Lots of water in there, and water or fat tissue looks white on an MRI scan. This structure here that looks like a Y, that's actually part of the spinal bones, the back portion of the spinal bones. So here's a spinal bone, and here's spinal bones, and there's joints in here. Now right beside the spine, there's muscles called the multifidus muscle. Now these muscles, again, muscles on MRIs that are normal look fairly black. The muscles, you look at the psoas muscles up in here, they look black. These muscles are black, and the other tissues behind here, other posterior spinal tissues are all black. Very little white structure. And that's what it normally should be. If we look at another MRI scan, we see where there's mild atrophy in the muscles beside the spine. Right here, you can see right beside the bones of the spine, all this white material in here. That's fatty infiltration. That is fat tissue that has replaced muscle tissue because of injury. So when the muscle atrophies and shrinks, it gets replaced by fat tissue, and fat tissue does not function the same as regular muscle tissue. So the circles here are outlining the areas of the multifidus muscles that are in charge of supporting the spine during posture and walking and so forth. The next picture here shows moderate atrophy. Again, if you compare the circular areas beside the spine, you compare normal to mild and then to moderate, you can see that there's more whitening adjacent or right beside the spinal bones. Again, these muscles are in charge of posture and balance, and when you don't have strength in your spine and poor balance and poor posture, then you increase the chance of further injury. And then the final picture here, look how severe the atrophy is and how much actual fatty tissue has invaded the muscle tissue, resulting in usually chronic pain that goes on, and a person who continually injures their back doing simple tasks such as bending down to pick up their shoe or whatever simple movement. This is a slide that talks about and looks at what happens when cartilage wears out. And this can happen anywhere in your body, but this is a picture of how it happens in your spine. If you look up here, follow my arrow, the joints between the spine, here's one of the joints, one side of the joint, it's called the facet joint, and it's usually got white cartilage that covers the joint to act as padding so that the joints can move smoothly. But we see in an arthritic joint how the padding is worn away, the tissue becomes irritated, the bones actually try to spread out to continue to provide support to the area. But again, this is a painful condition often, and people who have this condition injure their spines much more readily than people who don't have this condition. So it's the wearing out of the cartilage, and this is often a result, a long-term result of spinal injury. That a person injures their back, they have a perfectly normal spine, they have the pain and the spasm that goes on for weeks to months. It causes continued grinding of the spinal joints. The cartilage wears out, and it wears away, and then you got permanent arthritis.